Hello and welcome back. In this module, we'll explore the rights and responsibilities of health and social care workers, as well as how care workers can improve the quality of their work and their work environment. We'll also analyse the process of reflecting on your performance and show you the process of developing your skills in the health and social care field. But hold on, there's more. Just like the previous module, we've got additional materials waiting for you. You can check them out after we wrap up the module for a more in-depth understanding. So let's get started. We'll begin by exploring the roles of care workers. A health and social care worker's role is to assist people with disabilities to live their lives. This can take place in several settings, including the person's home, residential homes, or support facilities. So now you may be asking who they're supposed to be responsible for in such cases. Well, let's shed some light on that. Their responsibilities will include supporting family members in certain situations of need, supporting an individual with trouble or conflict in their relationships, helping those struggling due to age, supporting those suffering from mental disabilities, helping individuals struggling with addiction, helping physically disabled people retain independence, and supporting people with financial issues. Health and social care workers have the right to intervene in cases such as people who need to be protected from themselves, promoting human development and security, and people who require social inclusion and healthy participation. They may also help children with emotional shortcomings, children with special needs, adults who require help regaining independence and dignity, and elderly people. But do they have the authority to interfere on their own? Well, the answer is yes, they do. Social work employers can also determine if a social worker's inclusion is required in different situations. This may include if young or helpless people need shielding or removal from mishandling, disregard, or misuse, if someone brings trouble on themselves or others, if there's a likelihood of family deterioration or relationship breakdown, if guardians or caregivers are incapable. Now you may be wondering, as is natural, whether carers can be charged for their services. Well, in most cases, local authorities do not charge carers for providing support. If they do charge, they will first carry out a financial assessment. As we've explored the diverse roles of care workers, it's clear that their responsibilities extend far beyond the surface. So now let's move to a key aspect that enhances the quality of service in the realm of health and social care: reflective practice. You'll find more information on reflective practice in our additional material, but let's at least tell you how it helps. Reflective practice can help improve service quality. It allows substandard areas to be identified, understood, and adjusted. It allows you to gain knowledge and refine your skills. It allows you to assess your performance, comparing it to internal or external sources. It allows you to understand a complicated incident or situation. It allows you to know and recognize the positive, negative, and qualified results of the incident. It allows you to use it to determine if future practices can be improved. It allows you to answer questions and explain the situation using new or existing knowledge. It allows those involved in the incident to use it to explain their reactions. Now here's a pro tip to add an extra spark to your professional journey. Always keep your radar on for skill enhancement. And guess what? That's not all. Embrace the thrill of staying in sync with the latest and greatest in your field. Seek out new information because let's face it, the health and social care sector is a dynamic playground of constant evolution and exciting developments. So let's make sure you're not just keeping up, but staying ahead in the game. Now, I bet you're thinking, where can I get all of this valuable information? Well, don't worry, we've got your back.
The first option is research. Personal research or viewing current research allows you to acquire information. Effective research requires reliable and relevant sources. You should understand the context and the content and how the information was acquired. Another thing to keep in mind is that each research should have two main components: reliability and validity.
There are also several forms of research, such as primary, secondary, quantitative and qualitative research. However, it should be remembered that research is not the only option to obtain more information. There are a few other alternatives. There is media, such as newspapers, journals, documentaries, TV and magazines, which can offer useful information. You should, however, analyse their sources for validity. Another option is gaining information through conversations with people in the same profession. You can also ask for advice from superiors or more experienced figures. Finally, there are conferences which aim to deliver a message. You can also meet people from different organisations. This allows you to learn skills, share experiences, and have discussions.
Do you remember how we discussed reflective practices that assist care workers in improving the quality of their services? Well, now picture this. A dedicated care worker diligently puts all those reflective practices into action. What will happen? We believe you have the answer. Yes, it's the development. Reflective practice can lead to development.
Development can be both professional and personal. Professional development is the improvement of professional capabilities. On the other hand, personal development centres on both at work and in your private life. There are various ways to enhance both personal and professional development. Training plans and personal development plans are two of the many ways.
Now that you know how to improve your quality of service and how they impact on development, how can you know whether you're doing well? Well, the solution is obvious: performance evaluation. Evaluating your performance improves your abilities and your work environment. When evaluating yourself, there are 3 questions you must ask yourself. What are you trying to do? How will you do it? And how will you know when you've succeeded?
You can use various methods for self-evaluation, including writing down what you think is important, include what you may have done wrong and what you have learned. Questioning your approach helps you rethink the issue and consider other strategies. Talking with someone helps you organise your thoughts before speaking to them. Here, we'll concentrate on writing, specifically reflective writing. Reflective writing is a self-evaluation method which involves writing down the experience, reflecting upon it, and drawing conclusions. This process will help you learn something from an issue. It can involve examining how we've handled change. You can ask yourself questions, including: what happened? What was your original plan? How do you feel about what happened? Have you learned new skills? In another incident, what would you do differently or similarly?
Let's now turn our attention to another important aspect of this module. We've discussed the obligations of care workers. What do you believe is left? Well, yes, you are accurate rights of carers. So, do you know your rights as a carer? If not, don't worry, because the following discussion will remove any doubts about your rights.
If you provide care to an adult in need of it, you might be entitled to social care support under the Care Act 2014. You will require a carer's assessment to determine your needs. But what is a carer's assessment? A carer's assessment examines what your needs for support are, your ability to provide care and support, your willingness to provide care and support, how your needs for support affect your well-being, what you want to achieve and how this is impacted by your needs, whether giving you support will help you achieve your goals, and whether you work or want to work.
If you're a young carer, then you or your parents can request a young carer's assessment, which differs from the carer's assessment. It determines whether it's appropriate for you to become a carer and if you want to. A written record of the assessment will be given to you, your parents, and other people involved.
To be eligible, you must show that you have a need for support due to providing care for an adult. Your physical or mental health is or risks worsening as a result, or you are prevented from achieving other goals such as caring for a child or others, maintaining nutrition, engaging in work or education. Your needs will have a significant impact on your well-being.
Now you're probably wondering what happens if you're found to have eligible needs. Well, if the local authority determines that you have eligible needs for support, they have a duty to meet your needs. They must then prepare a support plan for you, which is similar to a care and support plan. You must be thinking that we've already covered all of your rights and responsibilities. That indicates we've reached the end. However, it isn't as simple as it sounds. There are some conflicts between rights and responsibilities as well. Rights and responsibilities can often conflict. You may face this problem when dealing with service users, and you need to make sure that there is a balance. The conflict might be a clash of rights and conflict between rights and responsibility. You'll get more information on conflicting rights and responsibilities in the attached material. We are now officially at the end of this module. I hope we were able to inform you about your rights and responsibilities as a carer. However, it doesn't end here. There's more to this. Caregivers and healthcare professionals must fulfill certain roles. These roles will be discussed more in the following modules. So to discover more about the roles, bear with us. We'll see you in the next module.